Yeah. Now go through this question. Go through this question for 30 seconds. Here, I did not introduce the question. Just go through. I'm explaining you how many parts are there here. Okay. Just go through this question. This is a sample question from the previous one, not the same one. Okay. This is the first one. This is called the background. Okay. This is called the background story. Okay, this is the background story. Then this is the question here. This is the question here. Yeah. This is the question here. Next. Yeah. These are the options. These are the options. There are three options, A, B, and C. Study this one because I'm going to change it afterwards. So three options. Now here, you will know about who is speaking, to whom is she speaking, about whom is she speaking, and what is this mode of speaking. So these are the four things which are very, very important. Who is speaking, to whom she is speaking, about whom is she speaking, and what is the mode of interaction. Okay. So she is talking, or the other patient is talking, or both are talking together, or this tells you giving a summary of what is happening, like that. So these are the four things. Number one, again, who is speaking? Who is speaking? That means the nurse is speaking. The nurse is speaking. So this is the speaker. The speaker. Who is the speaker? The next one. Who is the nurse speaking to? That means the listener. The listener. Then about whom is she speaking? About whom is she speaking? About a patient. That means the subject. The subject. Okay. The person for whom the nurses are responsible. Okay. Then what is this mode of speaking? Briefing. Means not explaining fully, summarizing and telling. That is briefing. Right. And next one, in this one, what does a she? She means nurse. Warn her colleague. About what is she warning? About what? About what? So the important, she is warning her colleague. She is warning. She is warning her colleague. This is not the text which we are going to do. That is a test we will have other one. This is a sample I took. That's all. She is warning her colleague. Warning. When do you warn? When do you warn? When some problem is there, you will give a warning. You will give a warning when there is something serious. Okay, life and death situation, problematic situation, whether it is unsafe, dangerous situation. You'll ring the sign, warning sign. You'll warn them. That's what it is. Now, warning about what? About something. She is warning her colleague about what? About what? Is she warning about antibiotics and related allergy? Antibiotics are the problem here because he is allergic or she is allergic. So antibiotics are problem. Some types of antibiotics are problem. So antibiotics, that is number one. Number two, care must be taken to prevent the patient from falling. Falling. So here allergy is the problem. Here falling is the problem. Here falling is the problem. He may fall down. If he falls down, he may break his bones. The patient from falling. Falling. So here allergy is the problem. Here falling is the problem. Here falling is the problem. He may fall down. If he falls down, he may break his bones. The patient from falling. Falling. So here allergy is the problem. Here falling is the problem. Somebody stopped a video, I think. Audio, open their audio. Wait. Cancel. Where is this? Have to check in there. Here everything is safe. Everything went wrong. What was there? Something? Resound. Is there any problem? 1 minute. Is there any problem now? Is there any resound? Yeah. Is there any resound now? Somebody opened their mic, I think. Two mics in the same room, maybe. Okay, careful, careful. So no disturbance. Now everything is fine. Okay. Kiran, is everything fine? Only one sound speaking. Srija, is everything fine? Yeah, Dr. Yaman, everything fine? Yeah, okay. Right, yes. Okay, okay, fine, fine. That's good. Somebody, don't open your mics, please. And some resound. Oh. Right. See, we lost a track of something important. Okay, no worries. I'll get it back. Yeah. Now, okay, falling. Falling is the problem here. Oxygen may be needed if the patients become breathless. Breathless is the problem here. Breathless. Breathless. breathing problem. A warning may be related to some problems. Warning, okay, warning may be related to problem. Warning may be related to allergy. Warning may be related to falling. Warning may be related to breathless situation. Okay. So this is how you have to identify the important word. Warning, he has allergies. So problem. The patient is allergic. So problem. So you're warning. Hey, be careful. He has a problem. That is allergy. Be careful. Why he falls down from his bed? Why he becomes breathless? Okay. She becomes breathless or he becomes breathless. So these are the three things. So focus on these words. Warning will be related to a problem. Warning will be related to a problem. Remember that. So now I want to ask you, yeah, have you understood the concept which I told you now? So this is how to identify. The proper word you will identify in the question warning. Okay. Now here warning is the key word in the question. Why are they warning? For what purpose? Okay. Is it to allergy? Or is it because of falling? Is it because of breathlessness? So there will be three options, and each option has one word which is important related to warning. If there is no allergy, why will you warn? If there is no falling, why will you warn? If there is no breathless situation, then why will you warn? All these three things they will be telling. Okay. So no need to worry. No need to take tension. Just relax, stay cool, and try to understand what he is telling. Right. So now we are going to the original question. Okay. Okay. So we have these 3 points here. We have these 3 points here. Go through this question. Go through this question, please. Yeah, I'm removing the distraction. My video. Now I'll ask you some questions. Now I'll ask you some questions and you have to answer these questions. Okay. Now the question is, who is the speaker? Answer. Who is the speaker? You have to question like this. Which nurse? If you type no, you will return the names, active participation, everything will be there. Palliative nurse. Okay. Next. Who is she? Who is the palliative nurse talking to? Okay, who is the palliation nurse talking to? Okay, that means who is the listener? Who is listening? Yeah, there's a point. How do you know that she is female? Huh? Vinita Ramakrishna. How do you know that she is a female? I know there is a reason, but how do you know that she is a female? Yeah, very good. Very good. Now, who is female? Patient is female or nurse is female? Who is female? Patient is female or nurse is female? So, patient is female voice. So, then nurse is male voice or female voice? Imagine, na? We'll test. Now, nurse, which voice? Male voice will be or female voice will be? Just roughly. Guess, we'll check. If we are right, we'll be happy. Otherwise, also no problem. We just guessed. Yeah. Yeah. Nurse is female, you mean? That means both are female. Then there will be confusion in the voice, right? Then you hear a palliative care nurse talking to an elderly patient. Okay, right. Now let us see. Palliative nurse. Okay. Palliative nurse is talking to an elderly patient. What is the patient most concerned about? What is the patient most concerned about? In this question, there's a question mark. There's a question mark. So in this question, there is one most important word. Can you type the word, please? Most important word. Come on, all of you. Jackson Kirime, spelling. Concerned spelling. Rewrite. Vinita spelling. Vinita spelling. Rewrite. Why capital letter Vinita? Kiran, why capital letter? Write with small letter. Very good. Very good. Concerned. Now, write the synonyms of the word. Okay, synonyms of the word. Write the synonyms of the word concern. Come on. Only worry, nothing else. Concerned, worried, upset, tensed, anxious. Come on, write down. Do you know that concern is related to another word? Yeah, bother, worry, disturb, distress, upset. Very good. Come on. What is your concern? Means what is your problem? Come on, write down. Problem. Problem, issue, difficulty. Yeah. Hazards, hurdles, obstacles, problems, issues. Yeah, right. Now we are going to listen to the audio. Before that one, I'll ask you one thing. Option A. Option A. What is the most important word in option A? Concerned about what? About something. So noun. About something. So noun. Yeah, related to what? A. Come on, find out the most important word in A. A. Yeah. Wait. Next one. Option B. Option B. In option B, one word, Geeta J. One word. One word which is more important. I don't want two words. Who wants two words? I want only one. Two words is headache. Find out one word. That's enough. Solid. Yeah. Very good. Option C. Option C. Option C. Actually, discomfort is not the point there. Actually, abdomen is the problem. Concerned about abdomen because there is a problem. Problem is not concern. Discomfort is not the problem. Abdomen is the problem because there is some discomfort. Discomfort where? Abdomen. Discomfort where? Abdomen. So abdomen is the key word there. You should realize that one. If you ask discomfort where, then you will say abdomen. You will say abdomen. Okay. You will say abdomen. So abdomen is the keyword. Yeah. Now let us listen to this. Yeah.
I stopped work a couple of years ago. But I still like a drink. Not a lot, but I do enjoy a few beers at the weekend, you know?
Well, it's good that you've stopped smoking. Were you having health problems when you decided to give up?
Well, everything seemed to start going wrong a couple of years ago when I got a hepatitis B infection.
Oh.
And I decided the cigarettes weren't helping that. And then not long after, about a year ago, they told me I got gallstones. That was pretty awful.
Oh, yes, it must have been. And how have you been since then?
Well, not brilliant, really. I got a blood clot about 6 months ago, in my calf. And they put me on warfarin, for that.
Yes.
And then last month, on top of everything, they told me I developed diabetes too. That was a bit of a surprise, to tell you the truth. I really hadn't seen that one coming.
No. Well, I can see that you've been through the mill this last year or so, one way or another. OK, what I'd like to do now is to get a couple of tests ordered. We'll start with a scan.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a palliative care nurse talking to an elderly patient. Now read the question.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
That'd be good.
Question 26. You hear a pharmacist.
Yeah. So you have seen this question 25. Okay, 7, 6, 5, 4, 3, 2, 1, and submit. Okay, that's fine. Now we will change this one. We will change this one into reading. This listening is going to be changed into reading. Okay. Okay. All right. I'm showing you something which is very, very important and which is very crucial for getting a grade. Actually, you don't need all these things. That's your problem. But I need to teach all these things. That is my problem. Why should I bother about your problem because you don't have time? That is your problem. You manage your time. I am managing my time and I am trying to explain you everything. Okay. But if you want to pass with excellent scores, at least to pass, all these things are needed. Okay. You'll definitely pass if you learn this one. Okay. Follow these techniques. That's very, very important. Yes. Right, now let us see here. Let us see this point very clearly. Okay. Now study this point. I'm converted in reading, listening into reading. Okay. I've converted listening into reading now. Now do the reading part. Okay. Now let us see that. Let us see very carefully. If you see carefully, concerned. I told you concerned. The word is concerned. Forget about this now. The word, the question word. The question word. Okay, the question word is concerned. Concerned. So concern. Okay, trouble. Okay, upset, worry. Okay. Now, what is the synonym of the word which you find in the audio text? In the dialogue. What is the synonym you find here? Synonym, please, from the audio. Here, trouble is there. Yes, you are right. The word trouble is there. Yeah. The word trouble is there. Yes. Right. Is anything a problem? Problem is there. Okay. Right. Yeah. Next one. Is there any trouble? Oh, sorry. This is male. It should go down. Okay. Okay. So, now let us see here. This is male. Yeah. Right. Problem. So changes in some diet. Is any problem for you over there? I might be losing a bit of weight because I don't. Does that trouble you? No. That means that is she's not concerned about losing weight. A change in her weight. This is ruled out because she's no. I just don't want to eat a lot. Does that trouble you? No. So A is ruled out. A is ruled out. That's it. Because she says no. No. Does that trouble you? She said no. That means this is ruled out. This option is ruled out. Okay. She is not bothered about the change in the weight. She reduced her weight. She is not bothered about that. Next one. If you see any trouble with your bowels, any trouble with your bowels, is asking very clearly. Any trouble with your bowels? Abdomen. Bowels. Where are the bowels? Okay. So, any trouble with your bowels? I know that you are taking regular laxatives. Okay. I know that you are taking regular laxatives. But is that an issue for you? So the other word is issue. Issue. Okay. Laxatives are medication, the treatment regime. I have had a bit of trouble with constipation over the years. Trouble with constipation over the years. I have taken pills on and off. I have taken something now actually. But I still feel a bit bloated, a bit crampy. So it's bothersome. Bother. So it's bothersome. Yeah. Now she's not saying no. Yeah, it's bothering me. Yeah means yes, it is bothering me. It is worrying me. It is worrying me. Try to understand that. Yeah, it is worrying me. It's not what you would call slight. That means it's not ordinary bothering. It's too much bothering. Extreme trouble. Extreme trouble. Okay. Okay, well, I think we need to have a look at you. Maybe make some adjustments to what you are taking, especially since you are getting that bloating. That would be good. Now based on these points, you tell me. Okay, now you have to tell me. What is your opinion now? So do you want to change your opinion? So question number 25. Do you have any changes to your opinion? What according to you is your answer, A or B or C? What according to you is the answer, A, B or C? Come on, write. Now this is a reading test. Now you understand how the points are there. Everything is talked about. Medication. She says doesn't have any problem with medication. It's only problem. Okay, I'm taking medication. Okay. Earlier I used to take and now also I'm taking. So where is the new treatment regime? Okay, now let us see the answer. Let us check your answer. Yeah. So this is reading brought forward. Okay. Test. Yeah. Part B. Question answers. Yeah. That is the answer. $25. C is the answer. C is the answer. So I think you understand now. Two people gave wrong answers. Okay. Two people gave wrong answers. So you know I don't want to take your name. No problem, but think carefully. Should understand. The lady is not telling that she has, that she's worried about that one. But when the doctor is telling, are you worried about? Yeah, it is not simple. It means it is serious. So that's what she's telling. So, was the explanation helpful? Okay. Was the conversion strategy, that means listening to reading, conversion strategy useful? Okay. Just to give your answer yes or no, so that we can move to the next question. Yeah. Next, we are moving to the next question. Yeah. Okay. focus, attention, concentration, technique, strategy. Focus, attention, concentration, technique, and strategy. Right. Right. Trouble, bothersome. Yeah, not slight. So you understand that very clearly. Okay, that's very clear. So here, losing a bit of weight is not a trouble. Taking regular laxatives is not an issue. Okay, but here, right, bloating sensation, that is for long time. Some abdominal discomforts. There is nothing called abdomen. There is nothing called abdomen. Constipation, okay, bloating, right? You can see that. So be careful. Yeah. Yeah. So we are moving to the next question now. Yeah, question number 26. You hear a pharmacist talking to a customer who is in pain. What is the patient most concerned about? So that's it. Okay. What is the customer seeking help about? An increase in her arthritic pain, discomfort due to a bite, discomfort due to a bite splint, a potential drug interaction, a potential drug interaction, a potential drug interaction. Yeah. There is the question. Go through the question for 1 minute. Study that point. Now we are going to discuss. Okay. Yeah. So we are going to discuss the 26th question. 26th question. Okay. Here we are. 26th question. Now let us see. Who is the speaker? Sorry. Who is the speaker? Come on. Or who is the medical professional? Which medical profession does he belong to? Or who is the speaker? Who is the person who is talking? Who is the authoritative person? Okay. Right. Then, who is he talking to? Who is he talking to? Come on, all of you. I'm just seeing how active you people are. Or you are very lazy or you are very active. That I'm checking. You don't know that. Okay. Who is he talking about? He's talking about customer. No, a customer. A customer. Remember, this is what we have to be very careful. A customer means one customer, not just customer. A customer. Okay. What is he experience? What is the customer experiencing? What is the customer experiencing? What is the customer experiencing? Okay. Now I'll ask another question. Who is offering help? Who is offering help? Who is offering help? Rajeshwari, pharmacist, a pharmacist, not pharmacists. Plural, no, a pharmacist. Okay, right. So, pharmacist. Very good. Who is expecting help? Who is expecting help? Okay, very good. Now it is not a customer, it is the customer. These are the things which I want to tell you. Initially, when you are introducing, he is a customer. Already introduced, and there is only one customer, so you have to say the customer. I'm teaching you logic, sir. Okay, remember that. The customer who was introduced before, that is already we know, so it cannot be a customer, it is the customer. Okay, be careful. I hope you understand the logic. Okay. I have a son. The son or the child, the second time when you are talking, because I already explained. So second time we are repeating, it will become the. Remember that. Next. Okay. Now what is the customer seeking help about? So here if you change this sentence, the customer is seeking help about something. What is that something? Is it regarding arthritis? Is in pain. Pain related to Arthritis? Is it related to arthritis? An increase in her arthritic pain. Okay. So arthritic is the keyword here. So arthritis, that's the keyword. Next one, discomfort. Pain means discomfort. Okay, discomfort means pain. So there is no much change here. Discomfort due to a bite splint. Discomfort due to a bite splint. So what is the most important word in this second one? Okay. What is the most important in the second option? B. Okay. Yeah, bite. Okay. Next in the C, what is it? What is the most important word? First one is arthritis, second one is bite, third one is what? Third one is what? Huh? Yeah. Second one is what? Drug. Very good. Drug. Interaction between what and drug? So drug interaction. Arthritic pain, arthritis. Pain related to arthritis. Interaction related to drug. Splint related to bite. So bite is important, arthritis is important, drug is important. You understand? Be careful. Okay? Be careful. So interaction means which interaction we'll say? It's a drug, more important than that. Next. So now we are going to listen to the audio. Get ready. So welcome to the platform, Shahnas. First time you joined the session, welcome. And Farzana, first time you have joined the session, welcome to the platform and be learning. Today you are given free sessions. Okay, this is a demonstration so that you will know what is going on here. Right. Yeah. Get ready.
Listen. Complete your answers as you listen. Now look at question 25. You hear a palliative care nurse talking to an elderly patient. Now read the question.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, you know, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
That'd be good.
Question 26. You hear a pharmacist talking to a customer who is in pain. Now read the question.
Good morning. Can I help you?
Yes, I've been in a bit of pain. I've got arthritis, you see, but it's not that, it's my jaw.
Oh, have you had this problem before?
Yes, it flares up when I get anxious and, I'm a bit stressed at the moment. I usually take some paracetamol, but I don't want to take too much because, I'm already taking arthritis medication.
Well, paracetamol is usually well tolerated and can be used with your anti-inflammatories. But you're right. Taking that is not getting to the root of the problem. Have you seen a dentist or a doctor about this?
Yes, I've had a bite splint at one time, but, well, it never really helped.
Well, I'd recommend seeing someone about it again because this can become a chronic problem.
Okay, you're probably right. Thanks so much.
Question 27. You hear a dietitian talk.
Yeah. So submit your response. Question number 26. Yeah. Yes. That's the point there. Now let me bring the script here. Yeah. Now let us make it into a reading test. Question number 26. Always one male and one female will be there. Remember that. Yeah. Okay. Yeah. Yeah. Yes. Let us check now. And it is converted into reading test now. Think about this and respond appropriately. So now, yes. Now you can see the difference. See the difference. Now you can tell the answer. Now submit your answer after thinking. Yes. Now give your answer. Have you realized what the answer is? That's important. Okay. What is the customer seeking help about? About what? I have been in a bit of pain. I have got arthritis, you see. I have been in a bit of pain. I have got arthritis, you see. But it's not that it's my, but it's not that. It's my jaw. The problem with the jaw. Arthritis is not the problem. I have been in a bit of pain. You see, I have got arthritis. But that's not. But it's not that. It's not that pain because of this. It's my jaw. Oh, have you had this problem before? Yeah, it flares when I get anxious, but I'm a bit stressed at the moment. I usually take some paracetamol. I take paracetamol, but I don't want to take too much. I don't want to take too much. Why? Why? Because, because, because Okay. Because, you know, I'm already taking arthritis medication. Okay. So because of this one, well, paracetamol is usually well tolerated. He's telling no problem with that. No problem with that. And it can be used with anti-inflammatories. It can be used with anti-inflammatories. Try to understand that. Okay. Paracetamol can be used with anti-inflammatories. Remember that. It can be used with anti-inflammatories. Okay. Okay. Is that clear? That's the point. Okay, fine. That's very clear. So this is the way how you have to answer. This is the way how you have to answer. So focus on the answers like this because he's talking about a medication. He's talking about medication. He's talking about drugs. He's talking about medication. He's talking about drugs. Okay, paracetamol is one medication and arthritis medication. Okay, where is I usually take some but I want because I'm with my arthritis medication. That is why she's asking. No problem. Paracetamol is usually well tolerated and can be used. So he's clarifying his doubt, her doubt. He's clarifying the doubt that there is no problem. So seeking help. That's it. Is that clear? So hope you understand that. So is the concept clear? That's it. This is the way how you have to understand. Print screen. Okay. So the answer is C. A, B, C. Focus, attention, concentration, techniques, and strategies. Facts. Yeah. Function, print screen. Yeah. That is the explanation. Okay, see you all after a break. I'll give you the link in the evening. So 2 questions we have learned. Listening. You can practice in the same way. Yeah. See you again. I'll send you the link.